when I think about living health in our strategy, I think about simplifying the customer experience, making the most of technology and innovation, while creating that personalized member experience. Simply put, we're cutting out what's getting in the way. We're engaging people early and often, and we're creating better insurance products.
Positively West Virginia is powered by Breezeline high-speed fiber internet and sponsored by Huntington Bank, Highmark West Virginia, Freedom Key of Morgantown, and Storymaker. With the help of these sponsors, we are able to share the positive business stories of West Virginians, including the one featured in today's episode.
Well, folks, we're visiting today with Linda Wigal. She's the Regional Vice President of Sales, and Lisa Marsh, Director of Clinical Strategy for Highmark West Virginia. Lisa and Linda, thanks for being on the podcast today. We really appreciate you guys.
Thanks for having us.
Absolutely. It's great to have you here. And honestly, I want to learn more about your work with Highmark, and also want to give a significant shout out and thank you for Highmark for being a long-term sponsor of Positively West Virginia. Linda, let's start with you. Linda Wigal, tell us a little bit about what your role is at Highmark West Virginia and your ties to the great state of West Virginia.
Yeah, thanks, Jim, for the question. And good afternoon. As Jim mentioned, I'm Linda Wigal. I have responsibility for the large group sales market in West Virginia for Highmark West Virginia. I've been with the company for 37 years, holding various roles throughout my career. I'm a WVU alumni, a 2023 West Virginia sharpshooter, and I have the honor and privilege of serving on various local and national boards. I'm a lifelong resident of West Virginia, and I'm proud to have my roots deeply planted in the Mountain State.
That's awesome, Linda. So you're a sharpshooter last year. That's amazing. So congratulations. And you're joining us today from Parkersburg, right?
I am, yes,
Yeah.
our corporate headquarters.
Awesome. Great to know that too. Lisa, tell us a little bit about your specific duties and role at Highmark West Virginia, and a little bit about your connection to West Virginia as well.
Thank you, Jim. I lead our clinical strategy team here at Highmark. I'm a registered nurse by background, and I have the distinct pleasure of leading a clinical team for Highmark that's responsible for influencing better health for the members that we serve and cost savings opportunities for the clients that we support. I've been with Highmark for 18 years. I'm also a lifelong West Virginian, born, raised, and educated in the Mountain State. And I feel fortunate that I've been able to raise my family here in West Virginia, and super passionate about transforming healthcare for all West Virginians. So I'm glad to be able to do that with Highmark. And I come to you today. I'm actually sitting in Barbersville, West Virginia.
All right. Well, great. Lisa, Linda, thank you guys so much. I want to ask each of you, you spent a long time at Highmark West Virginia. Obviously 37 years and 18 years respectively. There's something about the culture that has you drawn there. What inspired each of you? I'll start with Linda and then go to Lisa. What inspired each of you to get into the work that you're doing?
Yeah, thanks for the question, Jim. When we think about, our why, a couple of things come to mind, and one of those is health. And I think, good health is so important. And for most people, you take it for granted until something goes wrong. And so to be able to work for a company that's, passionate about access and providing solutions and things for individuals that address their health needs, I think that's very important to me. And I've seen the company evolve over the years, and it's very exciting to see the evolution and really the forward thinking of this organization. And I'm really excited about, the track we're on and the future.
I love it. Lisa, how about you? What's your inspiration for being in this career field?
Yeah, it's my passion as a clinician. It's my passion to influence better health, and also to serve the members of West Virginia. And I think about coming to Highmark 18 years ago. And one of the reasons I did that is I spent 12 years working for a West Virginia hospital before coming to Highmark. And I think about, my kids being very young then and not having great coverage for things like immunizations, preventive care. And I thought, you know what? If I go there, I can make a difference. And so if I think back now, 18 years later, that is table stakes for us. We're covering preventive care and all immunizations for the kids that we serve. And, our mission here is to transform healthcare. And we do it, one day at a time with one solution at a time. And that's my why. That's why I came to Highmark. That's why I've stayed at Highmark.
That's awesome. And I love both of your responses. Very powerful. And, I hear about Highmark's living health model and how Highmark is changing healthcare. Lisa, I want to start with you on this. I'd like to hear both of your all's thoughts on the living health model from Highmark and what that means for West Virginia.
Yeah, absolutely. Our living health model is about living a healthy life every day, and it's about supporting the living a healthy life for our members. And so instead of that reactive focus on how do we treat and pay for health programs or problems, it's really proactive. It's supporting each individual's health in the ways that they choose. We really want to serve up that next best action for them. It needs to be personalized. It needs to be individualized. And so the living health strategy allows us to integrate health coverage and care, leveraging purposeful collaboration between us, the payer, with our providers and with technology and community-based organizations. So that's what helps us to get to a simpler experience for the member, a personalized experience for the individual, and the opportunity to improve health overall.
Incredible. Linda, what are your thoughts on that?
Yeah, well, I would, certainly concur with everything Lisa said.
Sure.
When I think about living health in our strategy, I think about simplifying the customer experience, making the most of technology and innovation, while creating that personalized member experience. Simply put, we're cutting out what's getting in the way. We're engaging people early and often, and we're creating better insurance products.
Yeah, that's fantastic. And it's a generational change that can shift, right? When you get somebody who is leading a non-healthy lifestyle, just an unhealthy lifestyle, and you're able to change that and shift that, it's generational. Well, guys, I'm very taken by this whole living health model. I think it's very smart, and I love the way you guys are coming to the conversation. What would you say, Linda, I'll start with you, and then Lisa, I'll go to you after that. What would you say is the thing you're most excited about with Highmark West Virginia right now?
I would just say, we are challenging the status quo, and we are truly working to create a remarkable experience. We want to free people to be their best.
Yes.
And we're making bold decisions. I think about the collaboration that occurs with our provider partnerships, provider partners, for example, and really, just looking at things from a different lens. And it's a tough industry, and it taking on some of these things is challenging. But I am so incredibly proud, for the team at Highmark. They're forward thinking. And at the end of the day, we are seeing better outcomes. We're seeing, happier, healthier members. And that's really what it's about.
Awesome. Lisa, what are your thoughts on that? What's the thing you're most excited about for Highmark?
Yeah, one of the things is really around technology and innovation. So if you think about digital technologies that we're employing, including virtual care options, remote medical devices, this is all integral to the living health strategy because it brings that convenient health support to the people that we serve when and where they need it. So again, to Linda's point, it simplifies the experience. and it gives them tools that are cutting edge, and it allows us to improve health using the simplified and seamless experience.
Love it, Lisa. And we're going to come back and talk a little bit more about technology and how
Okay.
Highmark is integrating into the healthcare experience here. When we come back, we're going to mention our sponsors for Positively West Virginia, including Highmark West Virginia. We'll be right back.
It started with a road trip. Huntington bankers through big cities and small towns, where we met Jane and Dontel and their calendar. Every day predicting the money coming in and the money going out, which gave us an idea. What if we could set up a digital cash flow calendar for their business? So we built it for them. Why? Because we're for people. Huntington, welcome.
Your prescriptions are designed to keep you healthy, active, full of life. At Highmark Blue Cross Blue Shield, we're making vital medicine more affordable. Because when your prescriptions don't cost an arm and a leg, you can use those limbs for something more meaningful. Because life. Highmark Blue Cross Blue Shield, West Virginia.
Stay connected with an unbeatable deal from Breezeline. Get reliable, fiber-powered 500 megabits internet for $39.99 per month with a $100 gift card and price lock guarantee, plus a free modem, free installation, and free Wi-Fi your way. Folks, here at Interaction Media, we're a media company, and we rely on high-speed internet every single day to get our jobs done. That's why we use Breezeline. It's affordable, it's fast, and they're awesome people as well. Learn more at breezeline.com. And we're back. Our guests today are Linda Wigal. She's the Regional Vice President of Sales with Highmark West Virginia, and Lisa Marsh, Director of Clinical Strategy at Highmark. Linda and Lisa, let's jump right back into it. Lisa, you were talking about technology. If you could maybe give us more background, because I'm very intrigued with the whole technology model, especially here in West Virginia. We have some issues with access to healthcare a lot of times, and technology could really improve that. How's Highmark helping in that regard?
Yeah, absolutely. Our digital solutions today are designed to strengthen the patient-clinician relationship and to simplify the communications by leveraging evidence-based medicine and predictive analytics so that we can identify and serve up the next best action for our members that lead them to better health. So if you think about the solutions, we have a digital front door. So when you think about members trying to remember, where do I go to find something, we can send them to one location. So our digital front door has access to all of the solutions, and we're able to use analytics to identify which solution do we want them to engage in. Is it a diabetes solution? Is it a mental well-being solution? Is it a musculoskeletal solution? So by simplifying that experience, we can serve up those programs for them. And we have all of those options that we can use technology, for example, to support our members that might have a mental health issue. So that's really exciting.
Yeah. So how does that work? Because obviously mental health, you're hearing about it more and more. I think especially since coming out of the pandemic, those were really tough times for a lot of folks here in West Virginia and across the country. How is Highmark helping those mental health issues with technology? Is there a specific way that you're doing that?
Yeah, absolutely. So what we know in West Virginia, that 1 in 4 individuals that we serve are dealing with a mental health condition today. We also know that individuals often delay care. From the onset of a mental health symptom like stress, anxiety, depression, till the time that they typically receive care ranges from 7 to 11 years.
Oh my goodness.
One of the reasons for the delay that we know is the lack of access to care. We know that many counties in West Virginia do not have mental health support. So we're working diligently to eliminate the access barrier to care. And so on January 1st, we launched our mental well-being solution that includes digital support, one-on-one care navigation, deeper clinical care through in-person and virtual therapy, and medication management that is also virtual and in person. and a 24/7 crisis line.
Well, that's very impressive and much needed in our state. So I appreciate you sharing that, Lisa. What about talk a little bit about Sword Health and what that's doing for especially blue collar jobs and workers here in West Virginia?
Yeah, absolutely. Similar to the stats on mental health, it's probably no surprise to anyone listening today that 1 in 3 adults in West Virginia have a musculoskeletal condition or are dealing with chronic pain. So
Mm,
1 in 3 people. So we recognize that members need access to care. They need more convenient and more affordable options to manage these conditions. And for those reasons, we launched our virtual physical care program in 2022, and then we expanded the program this year. And essentially, what it is, the virtual physical care program is our living health model in action. It creates that simple, personalized, engaging experience that leads to better health and lower cost. And it allows members to have virtual physical therapy in the comfort of their own home or anywhere they choose to participate in the program.
well, that's
So again,
amazing. Yeah.
it's an example of how we've used technology and
Technology,
brought the
exactly.
solution to the member's home.
Yeah, I love it, Lisa. Thank you for sharing that. Linda, how important is it to understand customers? I mean, obviously you're kind of on the front line of the customer side. How important is that?
Jim, I think it's incredibly important. Understanding the customer is key to any business success.
Hmm.
It leads to the ability to offer great service and build strong relationships. When we understand, what our customers' priorities are and the challenges they face, we can be more strategic with targeted solutions that are specific to their needs. But it's not always easy to understand the customer from the outside. So sometimes you have to really put yourself in the customer's shoes, like I did early on in my career when I visited a customer, a coal mining company that allowed me to go deep in the mine, which gave me a totally new perspective and deeper appreciation for their workforce. Today, what we know is customer interactions, whether on site or virtual, remain vitally important as employers face new challenges that require collaboration to address their most pressing needs and concerns. At the end of the day, our ultimate goal is to help our customers succeed in their business endeavors.
Yeah. Linda, how important is it? Like, you've been with Highmark for 37 years. Lisa's been there for 18 years. How important is it to understand, West Virginia
Yeah.
in your roles?
Yeah. When it comes to healthcare, what we know is that healthcare is a local decision and it's very personal. Having a
Mhm.
deep understanding of the West Virginia market and the challenges we face as a rural state allows us really to address the things that are important and top of mind for our customers, like access, behavioral health, social determinants of health, or sometimes referred to as SDOHs, and rising cost. It can be as simple as how far you have to drive to get to a health system or how many months it takes to get an appointment with a specialist. If we look at health metrics, whether it's our own DHHR or the Kaiser Foundation, West Virginia needs to continue to improve in the areas of health, safety, behavioral health, and substance use. Um, at Highmark, we're really working to improve these challenges by leveraging our 80 years of experience, our large market share, and our collaborative provider partnerships, really making it easier for members to engage in their health while delivering more value to employers with improved productivity.
Yeah, that's incredible. Linda, one final question I have for you is it focuses on, solutions. Are you able to share maybe a lesson that you've learned working with these clients? In other words, like business leaders care about a lot of things in their world, and healthcare obviously is one of them. What share with us a lesson that maybe you've learned over the years?
Yeah, I think, employers want to do the right thing for their employees. They are focused on employee health and well-being now more than ever. They want a simplified experience um, because let's face it, it's very important. It's a recruiting tool. It's a retention tool. So,
That's right. Yeah.
having a health benefits package that's attractive and, provides great products and services is very important. they want improved access, and they want next generation virtual and digital care.
Yeah. Yep, that's great. I can speak to this personally. Full disclosure, here at Interaction Media, my company, we have Highmark West Virginia, and you guys do a great job. So thank you for that on a personal level as well. And speaking of that, we're going to take another quick break just to mention our sponsors, of which Highmark West Virginia has been a longtime sponsor of our podcast. We'll be right back.
It's in the precision, the attention to detail, and the confidence that create a timeless look. Like Diamond Cuts Barbershop, Freedom Kia of Morgantown is not only committed to timeless design, but also fair pricing, excellent sales, and service with no hidden fees. You'll love the all-new 2024 Kia Sportage LX all-wheel drive leasing for just $265 per month. Wherever it is you're going, arrive with confidence and arrive in style. Visit Freedom Kia today, right off exit 153 on I-79 in Morgantown.
My name's Caitlin Furby. I'm an interior designer with Remarkable Interiors. Our time is very limited. We're trying to do everything we can possible to keep our clients' projects moving and rolling. So Storymaker has been really great for us for putting out how to explain our company. I can sit and agonize about a post. And is this right? Does this sound good? When I use Storymaker, it sounds so beautiful and it was so easy. And it saves me a lot of time to do the things that I'm really good at.
And we're back. Our guests today are Linda Wigal. She's the Regional Vice President of Sales, and Lisa Marsh, the Director of Clinical Strategy at Highmark West Virginia. Guys, let's jump right back into it. Lisa, we talked a lot about the current state of affairs. What are some things that you're excited about for the vision of Highmark West Virginia? Some of the things you're working on for the future.
Thanks, Jim. Yeah, each of the solutions that we talked about today allows us to deliver a great member experience and also favorable clinical outcomes and financial outcomes for the people that we serve here in West Virginia. And I just want everyone to know that we're not done yet. We know that there's more opportunity to influence better health for members of the Mountain State. And for example, we launched a diabetes management program in 2022. We expanded it this year. It's a virtual health clinic that allows access to endocrinologists and other clinicians. It offers remote prescribing, care coordination with PCPs, and the program supports many West Virginians that are living with diabetes today. We also launched a program that supports members that have congestive heart failure and chronic obstructive pulmonary disease. And on our roadmap, we're currently exploring solutions to support weight management challenges, women's health, and cancer, just to name a few. And I just want to say that it's our commitment that we will continue to evolve our living health strategy so that we can support members and their healthcare needs to influence better health for the West Virginians that we serve today and in the future.
Yeah, you mentioned congestive heart failure, diabetes, amongst two of the top things. And my hat's off to you, because those are things that are, these are conditions that many West Virginia, we rank, near the top of the list of, these outcomes for or these conditions, right? And those are very important for the state of West Virginia. So my hat's off to you guys on that. While I have both of you here, Linda, Lisa, anytime I have folks on the program that are business leaders, I have to ask the question because I'm a student of leadership, and I'll start with Lisa. What do you think is the most important attribute for a successful leader, especially in business today?
Oh, there's so many, but I guess I would maybe settle on the first that came to mind is adaptability. Having the ability to respond to changing dynamics, pivot when you need to pivot, and also embrace new opportunities and challenges. I think that allows us to consistently be learners. And as we adapt to the changing needs of health in general, our space as a payer, and also the healthcare needs of the people we serve.
I love it. Adaptability, powerful, great stuff. Linda, how about you? What do you think is one of the most important attributes of a successful business leader today?
Yeah, I think you have to have courage. I think you have to be courageous. Sometimes, you're going down a path that might be, you're paving your own path. It's a little scary at times. So I think being courageous is important. And I think, being resilient. Lisa mentioned that it's okay to pivot. And sometimes you have to pivot. And so to me, those are very important attributes. And really to be inspirational, to continue to aspire, look forward, continuous improvement.
Yeah, I love it. I love the courage. I love the adaptability piece. I want to ask you guys final question as we wrap up. What's one piece of advice each of you would give to somebody thinking about a career in your field, such as providing insurance, healthcare for young people here in West Virginia? Linda, I'll start with you.
Yeah, thanks, Jim. Personally, it's been a wonderful career. So I would encourage others to really consider it. It is so satisfying to know that you're making a difference.
Mm.
Being in the industry for 37 years, I've seen tremendous change.
Mm.
And I continue to learn. Every day I'm learning something new. Every day I'm challenging myself and hopefully, challenging others. So if somebody's interested in an exciting, dynamic, changing industry, this is definitely a great place to be. And
Awesome.
Highmark's a wonderful, wonderful company.
Love it. Love it. Yeah, I love the culture that you guys have there at Highmark. Lisa, how about your perspective? What's one piece of advice you would give?
Well, I'll put a plug in for, as a registered nurse by background, nursing is a great profession in general, and we need more individuals getting into the nursing profession. But I think being able to be a nurse at Highmark, West Virginia, I think, the advice is really marrying up that skill set with the passion every day for healthcare in general and really serving people it's a great compliment to bring the clinical expertise to the table and to be able to do what we do every day for Highmark.
Yeah, I love it. And I love the encouragement for young people that there are lots of careers in healthcare, in insurance here in West Virginia, and Highmark is leading the way. Linda Wigal, Regional Sales Vice President, and Lisa Marsh, Director of Clinical Strategy at Highmark West Virginia. It's been a real honor to have you both on the show today to talk about the great work that you're doing here in West Virginia to support not only employers, but employees of great companies throughout our state. And small business is a vital part of that. And I think what you guys are doing is really important. And I want to encourage you to keep up the great work.
Thank you so much.
Yeah, that's the living health model and how, Highmark is changing healthcare in West Virginia. It's really important. And I just I am grateful for both of you guys and all of the fine folks at Highmark West Virginia.
We'd like to thank our partners, Huntington Bank, Highmark West Virginia, Freedom Key of Morgantown, Storymaker, and our studio sponsor, Breezeline, for helping to share these positive stories. If you'd like to become a sponsor of the Positively West Virginia podcast, visit positively.wv.com/sponsor.
Well, folks, that's a wrap on another episode of Positively West Virginia. If you or someone you know would be a great guest on the show, drop us a line on our website at positively.wv.com. Of course, we appreciate you guys encouraging us along the way with your comments on social media, sharing these episodes so we can get the word out about great organizations like Highmark West Virginia here in our great state. And obviously, the reviews that you leave. We really appreciate that too. On behalf of our entire Positively West Virginia team, including our producer today, Mr. Justin Schofield behind the controls. Until next time, I'm your host, Jim Matuga. Stay positive, West Virginia.